This is Jessica Busada Davis, Senior Marketing Specialist at Ocsher Health. Young friends. That's Ocsher Digital Medicine. This is how Ocsher treats its patients whenever they ask them how many citizens have been trying for years to process grievances concerning patient abuse torture by university police officers and have not been allowed to. Typically, Shreveport citizens are ignored, blocked with all methods of communications. Will you help? That is Ocsher Health, Ocsher L.S.U Health Shreveport. That is their typical response when not excommunicating anybody who can communicate anything that causes them to help. They try to just block everyone who tries to get help for the abuse. I see cutting him and thank you for a message. Now we know that's not a human, that's just an automated response. But we know they saw this. And that's the typical response. Okay, Oshner L.S.U Health Report. Noted. The official response concerning patient abuse by Oshner L.S.U Health Report is to receive reports of patient abuse and not respond to address violations of human rights, including patient abuse torture by the University Police Department. Captain Jamie Walker of LSU Hospital University Police Department is documented also refusing to address patient abuse torture. Also, hospitalinspections.org. Not allowing citizens to report the ability to process grievances has been a constant over many instances of citizen reporting. Out a span of many years. Okay, that was automated. This is just to know that they see it because it's sent. They know that they got that message. That was seen. Alright. Patient rights grievances. Review of the log for the last 3 months. The reported grievances log for the last 3 months failed to include documented evidence. Failed to include documented evidence of any grievances reported from patient. It's always been like that. And they just don't allow a paper trail because in the hospital they do not they don't literally take any complaints of any people. They don't even have like complaint forms. It's not something that the hospital carries because they have their policy of just not caring at all, and whatever atrocities that happen, they just don't document it and pretend like it don't happen. And it's a real problem. It's always been a real problem. And no matter what citizens do, this was many years ago. No matter what citizens do, there's nobody that ever helps. because no one reports about it. Media and LSU always just try to make it disappear. And you can read this back yourself. Just back when smoking was at the hospital, and you know, it said in the petition that yeah, they're all doing drugs, and psychiatric patients are getting cigarette burns inflicted in the ER because in the ER they allow abuse and stuff. And, if anybody's interested, that can be like citizens that complain about that can tell you atrocities, and if you want, they can do it on a polygraph test for transparency. This hospital is yeah, it's a torture factory, and they know, but they don't care. Yep. Oh, and if you want to see the L.S.U. Hospital Police, the University of Police, they are, yeah, they're actually right here too. I don't see it, but Daniel Walker, look him up. Daniel Walker is aware of the patient abuse and torture, but he allows it, and he's on record stating, uh, when receiving complaints about abuse and torture of elderly women specifically, he he is he just says, "Oh, you got a lawyer?" And keep in mind, this is a many $1 million hospital organization that buys, attorney fees, but caters to the poor Medicaid, Medicare recipients of Shreveport mainly, the minorities, poor, disadvantaged, and disabled Americans of Shreveport. And when there is surgeries that is botched up, whenever there's complaints, whenever anything happens, uh, the hospital just stays as far away from accountability or showing kind of empathic human response, and they ignore all these things. They always have. It don't matter when you talk to them. It don't matter when they see you. None of that. You will always, you'll never be treated like a human being. They've got that perception that because the minority in poor Shreveport, and supposedly because that's a charity hospital, that they don't have to respect minorities, poor, disadvantaged, disabled people because they don't think that they deserve human rights, even though they charge them for it, medical services. But Ocsher Health, L.S.U. Health Report has a history of being guilty in court, receiving judgments against them, um, doing Medicare fraud, overbilling, all that stuff. So that's there, and this is reality. Ocsher Health.